Hello class, welcome to Chapter 8, the Musculoskeletal System. Go ahead and be sure you have your CPT codebook open to the musculoskeletal system, beginning at CPT code 20100 to 29999. Also have your textbook open to Chapter 8, the musculoskeletal system. Also have your highlighters, your pencils, any notes that you need to make along the way ready to go. And let's dive in. CPT is copyrighted by the American Medical Association. CPT is a registered trademark. In this lecture, we will review the musculoskeletal anatomy and common pathologies. We will also review the orthopedic surgery section of CPT. The skeletal system provides the framework of the body. It consists of 206 bones, joints, and cartilage, providing protection and support to the body organs. There is considerable variation in bone structure among both the races and the sexes, and even between individuals of the same sex and race. The sex of a skeleton can be determined. The bone structure of the pelvis often gives the most clues. Two main parts of the skeleton that you need to be familiar with, that is the axial and the appendicular skeletons. The axial skeleton is comprised of the bones of the head, such as the cranium or the skull, the neck, which includes the cervical vertebrae, and the trunk, which includes the ribs, sternum, vertebrae, and sacrum. The appendicular skeleton consists of bones of the limbs, including those forming the pectoral or shoulder and pelvic girdles. All bones are covered on the outside by a thin layer of periosteum. A cavity in a bone is known as an antrum or an air cell, also called a sinus in some cases. A hole through a bone is called a foramen. Bone tissue is living tissue. It is metabolically active, serving critical functions, and it is a hard form of connective tissue. Bones have a blood supply, venous drainage, and a sensory nerve supply. It also contains calcium and phosphorus. Functions of bone include protection for vital structures, support for the body in its vital cavities, mechanical basis for movement, storage of minerals like calcium and phosphorus, and production and storage of new blood cells. There are two types of bones, compact and spongy. Whenever two bones come together, whether movement is allowed, a joint is formed. It is also sometimes called an articulation. Actually, a joint can be a bone and cartilage, or even the same bone, such as the skull. Joints are subject not only to structural injuries and dislocations, but also to inflammatory conditions such as arthritis of various kinds. Sutures in the skull are a type of joint. This type of joint is found only in the skull, and these are immovable. The muscular system consists of muscles acting to move and position parts of the body. Most muscles are attached directly or indirectly through tendons to bones, cartilage, ligaments, or fascia, or some combination of these structures. Ligaments are bands or sheets of strong fibrous cords extending from one bone to another. They cross joints, attaching bones together. A tendon is a non-distensible, strong cord-like structure. Tendons are composed of dense fibrous connective tissues attaching muscle to bone. When measuring muscle length, tendons are included. Cartilage is a connective tissue characterized by its non-vascularity and firm consistency. There are three types of cartilage: hyaline, elastic, and fibrocartilage. Hyaline cartilage is found in only a few places in the body, the larynx, or another term, the voice box. Also found at the end of long bones at joints. Also found at the nose, and the articulation between the breastbone and the ribs. The fetal skeleton contains a large amount of hyaline cartilage. There are three types of muscle: skeletal or striated, smooth, and cardiac. Skeletal muscles move bones and other structures. Smooth muscle forms parts of the walls of most vessels and hollow organs. It also moves substances through viscera or organs, such as the intestines and the ureters. The movement is known as peristalsis. And then they also control movement through the blood vessels. There are no muscle in capillaries. Smooth muscle is an involuntary muscle, and it is innervated by the autonomic nervous system. It can undergo partial contraction for long periods. This can be very important in regulating the size of the lumen, which is the opening of the structure, like the intestines or the blood vessels. Cardiac muscle forms most of the walls of the heart and the adjacent parts of the great vessels, such as the aorta, the pulmonary vein, and the superior vena cava. Cardiac muscle contractions are not under voluntary control. It is regulated by a pacemaker, which is composed of special cardiac muscle fibers that are influenced by the autonomic nervous system. It is both striated and involuntary muscle. When muscles contract, their fibers shorten. This contraction causes movement of a body part. Muscle cells are long and slender and are called fibers rather than cells. Muscle power increases as the total number of muscle cells increase. When a muscle contracts and shortens, one of its attachments usually remains fixed and the other one moves. This fixed portion is usually proximal and called the origin. The insertion is usually distal and that part moves. Some muscles can act in both directions under different circumstances. Muscles are generally named based on characteristics such as size, shape, orientation of fibers, location, the number of origins, and muscle action. For example, size. Vastus is huge. Maximus is large. Longus is long. Minimus is small. Examples of muscles named for their shape: deltoid is triangular, trapezius is trapezoid, and teres is round. Examples of muscles named for location include gluteus for buttock, brachii for arm, lateralis for lateral. Muscles named for their action include an abductor, moves the limb away from the midline of the body. Adductor, moves the limb toward the midline. Flexor muscle causes flexion. The origin of a muscle was defined previously. Examples of muscles named for the number of origins is the biceps, such as the biceps brachii. Muscles can be named for the direction of orientation of fibers, so oblique is diagonal, circularis is circular. The axilla, or armpit, is a dome-shaped area between the arm and the lateral chest wall. The shape and size of the axilla varies depending on the position of the arm. The axilla provides a passageway for vessels and nerves going to and from the upper limb. It has an apex, a base, and 4 walls, 3 of which are composed of muscle. When the arm is abducted or moved away from the midline of the body, the boundaries of the axilla can be seen. Anteriorly is the pectoralis major muscle, the latimus dorsi muscle posteriorly, the serratus muscle anterior-medially, and the humerus laterally. The axilla is a passageway for vessels and nerves going to and from the upper limb. Part of the brachial plexus passes through the axilla. The brachial plexus is made up of spinal nerves C5, C6, C7, and C8. The brachial plexus is a major network of nerves supplying the upper limb. Many lymph nodes are located in the axilla. These lymph nodes receive lymph drainage from various parts of the body, including the thoracic wall and most of the breast, as well as from the upper limb. With an infected laceration to the lower arm, lymph nodes may be felt as small nodules in the axilla. Fractures have been given specific names, including the Caules fracture. This is the fracture of the distal radius with displacement and/or angulation of the distal bone. Smith's fracture is a reversed Caules fracture. It is a fracture of the distal radius with displacement of the fragment towards the palmar aspect. The Jones fracture is a transverse stress fracture of the proximal shaft of the fifth metatarsal. The Salter-Harris fracture is a fracture that involves the epiphyseal or growth plate of a bone, commonly occurs in children, and is divided into 9 different types. It occurs in 15% of childhood long bone fractures. Dupuytren's fracture is a fracture of the part of the fibula, one of the lower leg bones, with dislocation of the ankle. Monteggia's fracture is a fracture of the proximal ulna with dislocation of the head of the radius. Amazingly, broken bones heal. Even after bone growth has been completed, bones are continuously being reshaped. This is called bone remodeling. It is accomplished by the combined actions of osteoblast, or bone-forming cells, and osteoclast, known as bone-destroying cells. Osteoblasts are on the underside of the periosteum and are continuously depositing bone on the external bone surface. Osteoclasts break down bone tissue. This process is called bone resorption. The dynamic nature of bones with continual growth and resorption is a critical factor in fracture healing. Pain from a fracture comes from tissue swelling and damage to other structures in the area, as well as pain from the periosteum. Once a fracture has been diagnosed, initial treatment for most limb fractures is a splint. The joints above and below the injury are immobilized to prevent movement at the fracture site. When swelling and edema have gone down after a few days, surgery or casting may be applied depending on the injury. Manipulation is a treatment for broken bones, whereby the broken ends of bones are approximated for healing. Reduction is the correction through manipulation or surgery of a fracture to a normal anatomical position. You might want to think of reduction as a way to reduce the injury. Fixation of broken bones can be internal or external. External fixation is holding together of a broken bone by means of a plaster or fiberglass cast encircling the injured part while healing occurs. Internal fixation is use of devices such as pins, screws, wires, or plates, applied directly to the bony fragments to hold them in proper alignment for healing. In the ICD-10-CM codebook, Chapter 13 is the diseases of the musculoskeletal system and connective tissue. Chapter 18 is symptoms, signs, and abnormal clinical and laboratory findings. Chapter 19 is injury, poisoning, and certain other consequences of external causes. Traumatic fracture diagnosis codes will be found in Chapter 19, whereas most pathological fractures will be found in Chapter 13. Most of the codes in both chapters have site and laterality designations. Example, idiopathic gout elbow, M10.021 is idiopathic gout of the right elbow, whereas M10.022 is for the left elbow. And then M10.029 is of the unspecified elbow, whereas they did not tell us right or left. The site may be the bone, joint, or muscle involved. When more than one bone, muscle, or joint is involved, there is a multiple sites code available, such as M12.59, which is used for traumatic arthropathy multiple sites. When a multiple sites code is not available, multiple codes should be used to indicate each of the different sites. Codes for the musculoskeletal system can be considered acute or traumatic or chronic pathological. Most of the acute conditions are coded from Chapter 19, Injury and Poisoning and Certain Other Consequences of External Causes, and those are codes S00 to T88 of the ICD-10-CM codebook. The majority of chronic or recurrent conditions are coded from Chapter 13, diseases of the musculoskeletal system and connective tissue. Those codes would begin with M00 to M99. Systemic lupus erythematosus, which is M32, or lupus, which is an autoimmune inflammatory connective tissue disease that affects multiple body systems. Manifestations can occur in the joints, skin, cardiopulmonary system, the spleen, neurological system, renal system, hematologic system, and the gastrointestinal system. It is more common in women, and the cause is unknown. In ICD-10-CM, the manifestations of systemic lupus are included in the code, such as endocarditis in systemic lupus. The code would be M32.11. Lung involvement in systemic lupus, we would code that as M32.13. An arthropathy is a pathology or an abnormality of a joint, and the arthritic conditions are classified in this section. Many of the arthropathy codes require the use of another code first to specify an underlying disease. Rheumatoid arthritis, abbreviated RA, would fall into category M05. It is a chronic systemic autoimmune disease involving the joints. Inflammation of the peripheral joints is symmetrical in rheumatoid arthritis. These codes are listed based on RA with other conditions such as splenoadenomegalia, lung disease, vasculitis, and heart diseases, along with the site, with or without rheumatoid factor, and laterality. OA, which is osteoarthritis, would be found in category M15 to M19. This is the most common joint disorder. Symptoms include gradual onset of pain, stiffness, and occasional joint swelling. To accurately code osteoarthritis in ICD-10-CM, the documentation must include whether the arthritis is primary, secondary, or post-traumatic. It must also list the site and the laterality, right or left. Supporting structures of joints can become injured, traumatized, and torn. Common knee injuries include MCL, which is medial collateral ligament, or ACL, which is anterior cruciate ligament. Codes are listed for both chronic and acute conditions. A bucket handle tear is a tear of the lateral meniscus of the knee. The meniscus is a crescent-shaped fibrocartilaginous structure of the knee. The meniscus is directly on the articular surface of the joint. A dorsopathy is a disorder affecting the spinal column. The spine is divided into regions beginning superiorly. The cervical, there are 7. Thoracic, there are 12. And then the lumbar, there are 5. These disorders are classified according to what part of the spine is affected. 4th and 5th characters are required to specify the type of disorder and the area affected. Spondylosis is degeneration of deficient development of the articulating part of a vertebrae. It is an osteoarthritis resulting in inflammation of the spine. Ankylosing spondylitis is an arthritis of the spine and resembles rheumatoid arthritis and is more common in men. DDD, or degenerative disc disease, is deterioration of the disc between vertebrae. Individual vertebrae are separated by disc that provide strong attachments between the vertebral bodies, also permitting movement between adjacent vertebrae. They act as shock absorbers. With age and use, they wear out. Discs can be displaced or ruptured. Spinal stenosis is the narrowing of the spinal canal, which can put pressure on spinal nerves. This can result in pain and numbness in the back, buttock, and leg regions. Enthesiopathies are diseases occurring at the site of insertion of muscle tendons and ligaments into bones or joint capsules. Capsulitis is inflammation and pain of the tissues surrounding the joint. Tendinitis is inflammation of a tendon. Tenosynovitis is a more involved inflammation affecting the tendon and the tendon sheath lining. Bursitis is kind of a catch-all term describing inflammation of the bursa, which are small fluid-filled sacs in the joints. Synovitis is inflammation of the synovial membrane of a joint. This term is often used synonymously with arthritis. All of these disorders are coded based on where on the body, by their location. Compartment syndrome is pressure or compression of vital structures, such as nerves and blood vessels, in spaces with no give. This can lead to numbness, decreased function, and damage of these structures. These conditions can be caused by trauma or can be non-traumatic. Edema and swelling put pressure on structures affecting blood flow and nerve function. A bunion is a localized swelling caused by inflammation of the bursa with resulting fibrosis. Hallux valgus is a deviation of the tip of the great toe towards the outer or lateral side of the foot. Hallux valgus is spelled Hallux. Valgus is Valgus. Gus. Osteomyelitis is inflammation of the bone marrow cavities with thinning of the osseous bone. This is a very serious infection which can be extremely difficult to eradicate. Patients at risk for these infections include those with bone fractures, orthopedic surgeries, and those with diabetes. Excuse me. These infections can be acute, but often become chronic as they are difficult to eliminate. Osteochondroses are disorders of ossification centers in children, characterized by degeneration or aseptic necrosis, followed by reossification. These conditions are not a result of infection. They involve the epiphyses, which is part of a long bone developed from a center of ossification distinct from the shaft. Osteoporosis is a reduction in the quantity of bone or bone density. It occurs in postmenopausal women and elderly men. Inactivity can also result in osteoporosis. Osteoporotic bones fracture more easily. Pathologic fractures is a fracture caused by disease, such as an infection or a tumor leading to weakness of the bone. Most often, the cause is osteoporosis. There are 3 subcategories for pathological fractures found in the ICD-10-CM codebook. Pathologic fracture not elsewhere classified, meaning nowhere else to be found in the codebook, is M84.5, and then you'll need the final digits to complete the code. Pathologic fracture in neoplastic disease, stating a cancer is causing the pathological fracture. That is coded M84.5, and then you need to finish the code. Pathologic fracture in other disease, so the other disease is not mentioned, M84.6, and you would finish the code. Subcategory M84.4 is used for chronic fracture or pathological fracture, NOS. Pathological fracture in neoplastic disease instructs to code also the underlying neoplasm. Pathological fracture in other disease instructs to code also the underlying condition. All of these codes require 7 characters, with the last character indicating the episode of care. Remember to use placeholder X if needed. Example, pathological fracture, other site, M84.48, and then you complete the code. If this is an initial counter, we would report M84.48XA. For pathological fractures in osteoporosis, we will use category M80. You are instructed to use an additional code to identify major osseous defect if applicable, M89.7. Curvature of the spine describes difficulties including kyphosis, lordosis, and scoliosis. Kyphosis is an anterior curvature of the vertebral column, generally in the thoracic area. Lordosis is curvature of the lumbar spine. Scoliosis is a lateral curvature of the vertebral column. There can be a primary curve with a secondary compensatory curve as well. A sprain is an injury to a ligament where the joint is carried through a range of motion greater than normal, but there is no dislocation or fracture. Dislocations are injuries that occur when the joint is moved or forced out of the normal position. The joint is the place where the 2 or more bones come together and allows for movement of that area. ICD-10-CM has greatly expanded code choices for dislocations that include the extent of the dislocation as well as the position of the dislocation. A complete dislocation is also known as a luxation. That is spelled Luxation. Nursemaid's elbow is a partial dislocation of the elbow or proximal radial head dislocation. It is most common in small children and is caused by a sudden pull on the child's arm or hand. It is rarely seen in older children because the muscles and ligaments are stronger. Usually it is treated easily by manipulating the elbow into a flexed position while rotating the forearm. A break in a bone is called a fracture. Examples of closed fractures: comminuted, the bone is crushed or splintered into several pieces. Compression fracture, or impacted fracture, the bone is compressed onto another bone caused by trauma or osteoporosis and is commonly seen in vertebrae. Depressed, this fracture typically resulting from blunt force trauma to the skull. There is a portion of the bone that is pushed inward. A green stick fracture, the bone is broken on one surface and bent on the other. Think of the way a green twig will break when bent too far. This fracture occurs in children before all the bones have had time to harden. Impacted fracture, one part of a bone is driven forcefully into another. Simple fracture, the bone is broken in only one place. Torus or incomplete, one side of the bone buckles. This is most commonly in children because of their softer bones. Examples of open fractures: this is where the bone breaks in such a way that the bone fragments stick out through the skin, or a wound penetrates down to the broken bone. These types are called compound, or infected, or missile, or puncture, or with foreign body. So when you read any of these terms for closed fracture or open fracture, you have to know that depressed is a closed. You have to know that missile means open. So make sure you take extra time and study these terms to know whether they are open or closed fractures. Open fracture designations are often based on the Gustillo open fracture classification. 7 characters are added to indicate the type of encounter. This classification is grouped into 3 major category types to indicate the mechanism of the injury, soft tissue damage, and the degree of skeletal involvement. One of the main categories, Type 3, is further subdivided into Type 3A, Type 3B, and Type 3C to report levels of extensive damage. Type 1 is a wound less than 1 centimeter with minimal soft tissue injury. The wound bed is clean. Bone injury is simple with minimum comminution with intramedullary nailing. Average time to union is 21 to 28 weeks. Union meaning the time it's going to take for those bones to go back together. Type 3, wound is greater than 1 centimeter with moderate soft tissue injury. Wound bed is moderately contaminated. Fracture contains moderate comminution with intramedullary nailing. Average time to union, 26 to 28 weeks. Type 3, segmental fracture with displacement, fracture with diaphyseal segmental loss, fracture with associated vascular injury requiring repair, farmyard injuries or highly contaminated wounds, high velocity gunshot wound, fracture caused by crushing force from a fast moving vehicle. Those are all examples that might lead to a type 3. Type 3A, wound is less than 10 centimeters with crushed tissue and contamination. Soft tissue coverage of bone is usually possible with intramedullary nailing. Average time to union is 30 to 35 weeks. Type 3B, wound is greater than 10 centimeters with crushed tissue and contamination. Soft tissue is inadequate and requires regional or free flap with intramedullary nailing. Average time to union, 30 to 35 weeks. Type 3C, fracture in which there is a major vascular injury requiring repair for limb salvage. Fractures can be classified using the MESS, which stands for Mangled Extremity Severity Score. In some cases, it will be necessary to consider BKA, which is below the knee amputation, following the initial tibial fracture. Compartment syndrome was discussed earlier and is usually the result of an injury. There is an increased pressure in a confined space, impacting vital structures such as blood vessels and nerves. The rotator cuff of the shoulder is the upper half of the capsule of the shoulder joint, which is reinforced by tendons that have been inserted. It holds the head of the humerus in place. When this cuff is torn, surgery may be necessary and can be either open or arthroscopic, meaning the use of an endoscope. Nursemaid's elbow involves the elbow. It is a partial dislocation of the head of the radius. It is also called a malgagnia luxation. And we learned earlier that a luxation is a complete dislocation. External cause codes capture how the injury or health condition happened, meaning the cause. Also, the intent. What was it unintentional? Was it accidental? Or was it intentional? And then these codes also tell us where the event occurred. So the place of occurrence. These codes also tell us the activity of the patient at the time of the event. So what were they doing? These codes also tell us the person's status. Is this person a civilian? Is this person in the military? There is no national mandatory requirement for ICD-10-CM external cause codes reporting unless state-based external cause code reporting is mandated, or these codes are required by a specific payer, meaning the insurance company. Providers are encouraged to use them, however, to provide valuable documentation and data for injury prevention strategies. External cause codes are used with codes A through T and then the Z codes. They are applicable to injuries and are used for the length of the treatment. Assign the external cause code with the appropriate 7th character digit for each encounter. The selection is guided by the alphabetic index of the external causes and by the inclusion and exclusion notes in the tabular. No external cause codes are needed if the cause and intent are included in a code other than Chapter 20, such as T36.0x1A, poisoning by penicillin, accidental, unintentional initial encounter. Okay, now turning our attention to the musculoskeletal system in CPT codebook. This section will list procedures involving muscles, bones, joints, ligaments, tendons, and cartilage. It is the longest section in CPT. This section contains very useful anatomical illustrations at the beginning of the section. This is a good time to review anatomy and have a medical dictionary handy. The beginning of this section also contains several instructions with useful definitions. As this list demonstrates, the listings are grouped anatomically, beginning superiorly with the head, neck, and thorax. Wound exploration is listed first. This relates to a traumatic event, such as a gunshot or a stab wound. The general subheading is just that, general. It can be used to report various anatomic sites. As mentioned, the other subheadings are listed by anatomic site. The listings are also by the specific procedure and the condition. Orthopedic treatments, such as often performed in stages, plates and screws may be placed for approximation and stabilization. They often will be removed at a later point when healing is at a point that this can be done. The guidelines at the beginning of this section define closed, open, and percutaneous treatments. A closed treatment utilizes methods to treat fractures without an incision. The broken ends of the fractured bones are brought into approximation either with or without manipulation to promote healing. Traction may also be necessary to stabilize the fractured bone in place to heal. Open treatment requires an incision, either at the fracture site or remotely. Internal fixation involves placement of hardware such as screws or nails. Percutaneous skeletal fixation is a fracture treatment neither open nor closed. The fracture fragments are not visualized. Fixation is placed across the fracture site, usually using X-ray imaging. Not that the type of fracture, closed, compound, or open, does not have any coding correlation with the type of treatment provided. Traction is the act of drawing or pulling by force. This may be necessary to correctly align broken bone ends for healing. This may be accomplished by the use of a wire, pin, screw, or clamp attached to a bone, and this is referred to as skeletal traction. Skin traction is application of a force to a limb using strapping or felt applied directly to the skin only. External fixation is use of skeletal pins plus an attaching mechanism to treat or align a deformity. The general subheading begins with one code: incision and drainage of soft tissue abscess, subfascial. This is a deep procedure below the fascia. Fascia is below the skin and fat layers. It is very tough. A hernia is a defect or weakness in this fascia. The gristly white tissue on a steak that is very chewy is fascia. There is a paragraph of instructions with the section on wound exploration trauma. These wounds include gunshot and stab wounds. Wounds of this nature may be small to begin with, but it may be necessary to explore them and make them larger in the process. Excision refers to the biopsy and excision of muscle and bone. It is important to know the depth of a wound, and this will require good documentation by the provider. Codes are divided into superficial and deep excisions. A needle biopsy is usually superficial. Deep biopsies are performed on deeper structures such as major bones, such as the humerus or the femur. Introduction or removal codes report the removal of a foreign body or old hardware such as pins or screws. These codes require knowing the depth of tissue that must be incised to reach the foreign body. Injections involve insertion of a needle into an area for aspiration or for introduction of a medication. A graft is tissue transplanted to an area and is often called an implant. Arthrocentesis is a puncture of a joint with a needle for fluid removal and or injection. An example of this is injection of steroids into a joint for treatment of pain. This code does not include the drug itself. The drug supply code should be listed and coded separately. Grafts can be of various tissues, such as bone cartilage, tendon, or fascia lata, and is usually through a separate incision. Following grafts, often a splint or cast is placed to prevent movement or injury while it heals. The fascia lata is of deep fascia of the thigh. It is substantial. It encloses the large thigh muscles and becomes the iliotibial tract. Autografts are tissue transferred by grafting into a new position in the body of the same individual. Allografts are transplants between genetically non-identical individuals of the same species. Bone grafts are often taken from the patient's own iliac crest, which is the pelvic bone, ribs, or the fibula, which is a bone in the lower leg. Grafts are also called implants. Codes for obtaining autogenous bone, cartilage, tendon, or other tissues through separate incisions should be reported separately unless the code descriptor references the harvesting of the graft or implant. There is an instruction at the beginning of the section instructing to not append modifier 62 to bone graft codes. Free osteocutaneous flaps can include bone and skin with microvascular anastomoses, and we know anastomoses is to reconnect. Anastomoses, same thing. So just remember anastomosis, it means to reconnect. This is usually reconstructive surgery. Use of the operating microscope is reported separately. These types of flaps are used to treat high-energy extremity wounds from trauma with the loss of bone and soft tissue. An interstitial pressure monitoring device may be inserted into a muscle compartment to prevent muscle compartment syndrome from developing. These anatomical subheadings begin with the head. As in other sections of CPT procedures, these are divided by the procedure performed beginning with incision. Codes related to procedures on the head include structures of the skull, facial bones, and the temporomandibular joint, acronym TMJ. Documentation quality and quantity are essential to accurate reporting. The repair, revision, and/or reconstruction listings is a very large section. The spine or the vertebral column begins with instructions and examples. Surgery on the spine often includes the surgery on the nerves found there. The spine is divided into 3 sections. The cervical area, which includes 7 vertebrae, C1 for the first cervical vertebrae. Atlas is the first cervical vertebrae. It articulates with the occipital bone of the skull. C2 is called the axis, and it is the second cervical vertebrae. All of the cervical vertebrae collectively are referred to as C1 through C7. Thoracic vertebrae come next and includes 12 vertebrae. They are referred to as T1 for the first thoracic vertebrae, and so forth. Next comes the lumbar spine, vertebrae L1 to L5. At times, op reports can specify areas involving portions of one or more than one group of vertebrae. For example, if a procedure was performed on C6 through T3, vertebrae involved includes C6, C7, T1, T2, and T3. Overall, that is 5 vertebrae. The space between each vertebrae contains an intervertebral disc, the nucleus pulposus, the annulus fibrosus, and 2 cartilaginous end plates. A vertebral segment describes the basic constituent part into which the spine may be divided. This includes a single complete vertebral bone with its articular processes and lamina. A lamina is a thin plate or flat layer on the individual vertebrae. Segmental refers to the individual segments as previously described. For example, if a procedure is described as segmental for levels T3 through T7, 5 segments are involved: T3, T4, T5, T6, and T7. Non-segmental indicates a device that has been attached spanning a section of vertebrae, not the individual vertebrae. Casts and splints serve to immobilize a body part. They can be done to allow swelling to decrease and to immobilize areas for healing. Casts are made of various materials including plaster, fiberglass, or synthetic materials. Splints often involve bracing on one side, with splints held in place by tape or bandages. These treatments can be temporary or definitive. Casts and splints can be used for fractures, strains, or sprains. They are also commonly used following surgical repair. Application of the first cast or a strapping device is part of the global surgical care for these procedures. This is true regardless of whether the cast is applied to treat a fracture or to immobilize an extremity following surgery. The type of fracture does not dictate the type of treatment. If additional or replacement casts are required, this will need to be reported separately. When a cast or strapping are reapplied, the removal of the old cast or strap is included. When a physician applies a temporary cast, splint, or strapping, and another physician provides the definitive treatment of a fracture, each physician may report for the services that they provided. An endoscopic or arthroscopic procedure is an examination of a joint using a scope. Surgical arthroscopic procedures always include a diagnostic arthroscopy of the same joint. If the procedure begins as a diagnostic scope, meaning we're trying to find what the problem is, and then an open procedure is required, it is okay to report both procedures and add modifiers 59, distinct procedural service, and 51, multiple procedures, to the same diagnostic scope code. However, if it is diagnostic and you convert to a mediastinoscopy or meniscectomy, then the diagnostic is included in the surgical. So you would only code the surgical code in that instance. Arthroscopic procedures of joints include procedures on the shoulder, wrist, spine, hip, knee, ankle, hand, and foot. As the CPT code book is large and there are numerous procedures performed, a lot of supplies and support materials can be required. Orthotics is the science concerned with making and fitting of orthopedics appliances. Prosthetics is the art and science of making and adjusting artificial parts for the human body. A prosthesist is one skilled in constructing and fitting prostheses. The HCPCS Level 2 codes are for orthotic and prosthetic procedures and supplies. There are many HCPCS Level 2 codes used for musculoskeletal and orthopedic services. These include crutches, walkers, canes, traction devices, wheelchairs, and other orthopedic supplies. These supplies are called Durable Medical Equipment, or DME. Modifiers are frequently used in orthopedic surgery to indicate the side of the body the surgery was performed. They may be necessary to report which finger or which toe was repaired, or to indicate that the procedures were performed on both sides of the body. When using modifiers, it may be helpful to check with payers to see what codes to list. This applies to modifier 50, bilateral procedure, and it may be necessary to use modifiers LT, left side, and RT, right side. They may prefer a single code with modifier 50. Modifier 54 is surgical care only and may apply when care is provided by multiple providers or the patient changes locations. Modifier 59, distinct procedural service, indicates that a service should not be bundled when it normally might be bundled. Modifier 62, two surgeons, is listed when two surgeons work together to perform distinct portions of the same service. The same CPT code must be used. Fingers and toes can be specified individually. FA is left hand thumb. F5 is right hand thumb. The other designations, FA through F9, are used to list all of the fingers. TA through T9 list all the toes. And this concludes our lecture for the musculoskeletal system. Be sure to read your chapters, do all of your assignments. These assignments will help you in being successful on your national exam when you get there. So please, if you have any questions or concerns, let me know. Otherwise, I'll see you soon for lecture on Chapter 9.